ABA professionals play a significant role in helping individuals achieve their goals and improve their quality of life. But what are the best ways to exhibit professionalism in ABA? Hi, I'm Shira.
And I'm Shayna. We're behavior analysts that create weekly content about how to teach children with autism so that they make real progress. And we create shareable resources to make your job just a little easier. Today's topic is all about professionalism and ABA. And if you want more videos like this, make sure to subscribe and hit the notification bell to stay updated on new video releases.
I was once on a team with one of the therapists who was going through, a bit of a difficult time. But she really brought it into work. And when I would go in for observations, she would spend a lot of time talking about, her personal life and the things that she's struggling with. And, she'd want people's opinions and kind of, over dramatizing a lot of parts of what was going on. And it took up a lot of time. And it ended up taking away from my time with the client and also involving the family in this. And it was very hard to say, this really isn't the time or the place to be discussing this, but it does come down to that level of professionalism. And we should all be aware what that level is and how we can really show professionalism in our roles as ABA therapists, RBTs, paraprofessionals.
So to start off, let's define what professionalism means in the context of ABA. It's not just about dressing well or having a fancy title. It really does encompass a wide range of behaviors, attitudes, ethical considerations. ABA professionals are expected to maintain the highest standards of behavior and conduct to ensure effective treatment.
Yeah, and it's about, treating our clients with respect and dignity. We have an ethical code that talks about what we're allowed to talk about, how we should communicate, how we should collaborate, cultural sensitivity. And so we really recommend that as an RBT or an ABA professionals, go check out the ethical compliance code on the behavior analyst certification board, because it's really important to be really familiar with that code because it's important that we adhere to that at all times.
We really do have to maintain ethical integrity, right? We have to treat clients with respect and dignity, and we have to adhere to these practices, right? And we have to collaborate with interdisciplinary teams as well. And that's all in that ethics code. But getting away from the ethics code, yes, of course, we have to maintain ethics and client dignity and everything else. Let's talk about professionalism in general. Leaving things at the door. So if you're walking into a client's home, or if you're walking into a classroom situation, or a clinic setting, make sure that you do whatever you need to do to debrief yourself, before you walk in that door. Leave those personal things at the door. And I know that can be really tough. And if it's too tough to leave it at the door, don't come in that day, because your energy really does affect the energy of the entire team. And, especially if you're in a client's home, you want to develop, rapport with clients and rapport with the parents. But at the same time, those parents have so much on their plates already. They don't need one more thing to have to worry about, or one more thing that they have to consider.
And it's important what you said, if you feel like you can't leave it at the door, and if you are at risk of burnout or some way that, is affecting your own well-being, you need to be able to identify that and be able to have enough, self-care or awareness of your own needs to know when you might need a break. Maybe you need a different schedule. Maybe you need to change what you're doing on the weekend so that you have more energy for your clients. But figuring out what that balance is so that you can really show up professionally for your clients. And when we say professionally, it's not just about, like we said, the dress code, but it's about presenting yourself professionally. If you go to any other professional, you want to feel like they've, come at their best. They didn't just roll out of bed and they're not, in a grouchy mood and they're starving and, they don't look presentable. So it's all of those pieces that put together a professional appearance that you are bringing to your job.
I did a staff training one time and I showed 2 cans of soup, and they were both the same can of soup, but one of the cans was all banged up and it had a ripped label on it. And then I showed the can that looked pretty new. And I said, if you were at a grocery store, which can of soup would you grab first? And, most, I think, if not all, everybody said, well, I'd grab that one, the one that's in the nice looking tin and everything else. And, my point wasn't about dress code, but my point was more about just in general, your presentation, right? It's that perception versus reality. And, you still are in a job, yes, you need to dress comfortably if you're working for kids, but at the same time, don't show up with, a ripped, I was going to say a ripped crotch, but ripped pants at all, or, anything that looks like you just rolled out of bed, because it really does give that appearance of, I don't care about what I do. I don't care about your kid. I don't care about any of this. And that's not true. We know you do. And I know that, you want to be here. So make sure that you can show people that you want to be there. And another thing about showing people that you want to be there would be putting your phone away. And I know that that can sometimes be tough. There might be an emergency you need and everything else, but really, we talk about competing reinforcers with kids we work with, and competing reinforcers are more about, well, how can I get my kids, the kid I work with, or the student's attention, because they're on the phone, and I have nothing that competes with that. I know there's nothing more valuable than that kid being on an iPad. And I know for us, our phones can be calling us, and that social media can be calling us. If it's that tempting, leave it in your purse, leave it in the car, do something with it, because you're paid to be with a kiddo and not on the phone.
And we need to have that same level of professionalism towards the families. We can often, make assumptions about how things are working, especially if we're in families' homes. And there's a lot that we don't know about. We don't have the full picture. And so trying not to make those assumptions, trying not to judge the families that we're a part of, that we're working with, but especially not then gossiping to other people. Not, even if it's something you don't agree with, even if you're not using anyone's names, it does create this judgmentalism, if that's a word. And it creates a negative vibe if you're gossiping to other people about how you really don't agree with the way that they were doing something. There's so much that you don't know. And so trying to just have the benefit of the doubt and being professional in how you approach the families as well.
Working with clients can be a really hard job, and working with families can be even tougher. And, it can be frustrating if you're giving families programs and they're not following through with them, or if you're giving them suggestions and they're not following through. That is super, super frustrating. I get it. I've been there. What I typically do is something goes through my head that's probably not so awesome about the family, and I rephrase it and I say, okay, well, let's think about reasons why they weren't able to follow through. And the first reason is, well, what could I have done differently, right? But secondly, what's on their plate that they can't follow through with this? Why is the family acting this way? And it's usually because they're burnt out, or the family themselves is going through some type of trauma. So really putting yourselves in the family's shoes instead of being judgmental. Sure, you mentioned a good one about gossiping and, not gossiping about the family, but also, if you're in a work environment with other people, not gossiping about other people. And sometimes that can be tough because other people may approach you and say, oh, did you hear about so-and-so? And even though it's not your client, it's nothing to do with your client or nothing to do with the family, it's so easy to say, yeah, and somehow you need to be able to disconnect and say, I really don't want to talk about that. Or, she's a friend of mine. I prefer not to do that. Or somehow make yourself busy and walk away from that situation.
And if there really is an issue where you feel like something is unjust or unfair, that's where you should turn to the ethical code. There are ways to resolve those issues, whether it's going to your supervisor or ways to communicate things that are actually effective and not just creating negativity, because negativity is one of the worst things that once it starts on a team, it really just affects everybody and it's not pleasant.
Yeah. So, as much as you can, smile, be kind, have those manners, try and maintain those boundaries, right? So yes, you should be, friends with your coworkers and friendly enough and, pairing yourself with the families so that they're comfortable inviting you into their homes, or, enough that you're able to communicate and have a 5-minute conversation after the classroom. But not too personal. Don't get too personal and involved with, families, coworkers. It's okay to go out with coworkers, but, divulging too much information to the point where you've just crossed a professional boundary, not so cool, not cool and not ethical.
Right. And you mentioned the smiling and the facial expressions. It's also in your tone of voice. I've worked with some therapists who, like, it's a challenging job. And sometimes you can get a little bit cynical, especially when it's your personality, to be a little bit sarcastic. And then that starts coming out in dealing with some of the behaviors that our kids are dealing with. And when you're sarcastic with them, it doesn't really help. And it just kind of breeds it again, the negativity. So watch for your tone of voice, your facial expressions, the words that you're using. And if you need to step away because you're really struggling, find someone else who can replace you in that moment, and you can step away, do what you need to do so that you can come back and show up in a way that your clients need you to.
So, we stress throughout so many of our trainings, communication, communication, communication. And it's so true. When you first start a job, ask some of those questions. How do you want me to communicate with you? If I'm talking to a family, listen, like, how do you want the communication? Do you want to talk for 5 minutes at the end of every session? Do you want to, but time is valuable. I want to work with your kiddo as much as I possibly can. Stress that piece. Do you want me to write in a communication book? What do you want to know? If you're, with coworkers, ask the first thing you do when you get hired, okay, so who do I talk to regarding this or that? Or if something comes up regarding a parent, who do I talk to? And I've heard the saying before, excuse my language, bitch up, right? So you always want to complain up and never complain down. So, if I'm at a supervisor level, I'm never going to talk. I'm not going to complain about people to my staff. I'm going to always go upwards. So talk to, whoever's in charge, your BCBA, your supervisor, or somebody like that. Don't complain to the families, take it elsewhere, period. But it is really important to have that line of communication so that you can feel heard for sure.
Yeah. We're all human. So we all need to vent a little bit, but be careful about where that's going. One of the most helpful things I also find in maintaining boundaries is we draw the line on personal cell phones. So we will communicate with families, we'll support them, we'll respond to their emails, but we have, a rule that says, but we don't communicate via personal cell phones. I find that helps with your, sanity and self-care, that you're not getting those beeping messages at, 11 o'clock at night. You can kind of shut off your email, you can put away your computer, and you can get back to it the next day. And it also is a way that we can still support families, but knowing we have, our own boundaries that we abide to.
I also find that when you're communicating with families, having a time, say once a week. So, every Friday at 9 o'clock, excuse me, we're going to have a phone call. And that seems to help with the, text messaging and everything else at different times throughout the day. The one thing that you really, really want to be clear with families on, as well as your supervisor, as well as with, people you're working with, is your schedule, right? Like, I abide by my calendar so much, but my schedule changes. It can be frustrating. Making sure that families have as much advance notice as possible if you need to cancel a session, that your supervisor knows if you need to cancel a session, and vice versa. If your supervisor is going to change the schedule around on you, make sure that you're clear and say, listen, I really need to know about schedule changes in advance if possible.
Overall, be respectful. Listen to everyone on the team, let everybody have a voice and have a say, and communicate effectively, and just, be professional in the way that you approach other people and work amongst other people. The respect is going to be the most important thing that you give off.
Absolutely. And, the last thing what we're talking about when we're talking about professionalism is, really about recommendations. So, sometimes families will come up to you and say, well, what do you think of this? Or, I'm considering this, or what are your thoughts on that? Classroom teachers might do it. Coworkers might say something. Try and bring it back to data if you can. You're an ABA professional, you should have data and some type of data to support you. And, making sure that, it's not just, well, I think that, or I, whatever. Oh, hey, let's check the data, or let's get some data on that, and then we can come back to you and answer that question.
And I think sometimes it's professionals will want to make like certain, promises, like, oh yeah, we could definitely help you with that, or your kid's going to be reading, no problem, or we'll definitely. And I would hesitate to make those kind of promises and recommendations, because it's not fair. You really have to make those assumptions on data. You can't make any promises or guarantees to families. It's not fair to them. And we just have to say, well, we hope that this will be the case, or this will be the result. But maintaining that level of professionalism in how you speak to the parents and how you give over that information.
So, there's a lot more to ABA therapy than just implementing great teaching procedures with kids. I wish that was all it was, but there's a lot more, and professionalism is one of those things that is so huge. So, making sure that, you do maintain those, that professionalism, those ethical guidelines, and those professional boundaries. If you're burnt out, check out some videos that we have on how to prevent burnout. So in summary, we discussed what it means to be professional when working in the field of ABA.
So if you like what you heard today and you'd like to hear more on topics that you think all ABA professionals should know, check out our new video training series called The Behavior Blueprint for ABA Therapists, RVTs, Paraprofessionals, and more. Click the link on or around this video to learn more about the Behavior Blueprint.
For more information on professionalism in ABA and other topics that you think all ABA professionals should know, click the link in and around this video or in the description to check out the Behavior Blueprint. We also encourage you to subscribe to the channel so that you don't miss any future videos, and leave a like and comment below if you have further questions.